Hello, everyone. We'll get going in a moment. We'll just wait a minute or two for people who've signed up to call in. Rushing in now. Okay, let's make a gentle start as people are starting to come in. I'll waffle for a minute or two and then I'll hand over to the man of the moment. So welcome everybody to this month's research seminar. We are very happy to welcome from the Trust, Tom Rhodes, who is the study manager for the Working on Worries study, which he'll be talking to you about today. The Working on Worries study is not really a research project, it's an implementation project which is being supported by the Mental Health Implementation Network, hosted by King's College London, and they pick up innovations or interventions which are particularly ripe for implementation into the healthcare system, and they support organisations to be able to do that and then to evaluate the effectiveness of that implementation. So that would be the story that Tom is talking about today. All of your mics and cameras are turned off. You'll all be very relieved to know. So you can all eat your sandwiches and have your lunch and go and get a coffee as much as you like during the course of this session. If there are any burning questions that you want to ask during this session, please use the Q&A function. And if you particularly like a question and you want it to be asked at the end, please give that a thumbs up as well. And that question will be given priority in case we run a bit short of time, as we're due to finish and let you all go no later than 1:15. So that is everything from me before I hand over to Tom.
Thank you, Bonnie. I'll just now share the slides. Apologies, I do have a bit of a cold at the moment, so I might need a few cough breaks, but otherwise we should be good for today. Let's just see if we can get that shared.
Yep, that looks good.
Excellent, thank you. Okay. So, afternoon, everyone. So, my name is Tom Rhodes. I work at Norfolk and Suffolk Foundation Trust, obviously, and study manager for the Working on Worries project. So, the Working on Worries project is looking at implementing a parent-led cognitive behavioural therapy intervention, which we're referring to as PLCBT, in a school setting. So, over the next 30 minutes or so, I'll briefly discuss the intervention, how this study came about, the steps we took to deliver it, look at some of the feedback we've had over the last 2 years and what is happening with it now. I don't think I'll be able to see any functions or chat or anything or any questions sort of meanwhile. So if anything's burning down, I might need a note to let me know that halfway through the presentation. Thank you. So initially we'll just have a very brief sort of overview of parent-led CBT. So the parent-led CBT intervention is an approach developed by Cathy Cresswell at the University of Oxford. And this aims to address child anxiety by teaching parents and carers cognitive behavioural strategies for managing their children's worries. So this presents a good solution to improve access to anxiety treatments across a range of settings. And based on belief that parents and carers are well placed to implement these strategies in children's day-to-day lives and help empower them to support with these worries. So there are two formats of the intervention. So initially developed was an in-person format with helping your child with fears and worries. This was available in a book available, which is available for anyone to purchase. And so this is a self-help guide, which includes 4 in-person sessions, up to an hour, and with 2 shorter telephone sessions. And the other format, which is more new process, and I think it was developed originally over sort of COVID times, with trying to provide this sort of intervention in a more online environment when face-to-face sessions are obviously a bit more difficult at the time. But this online support intervention version, this is known as Aussie for short, which has been developed. And this consists of 8 online modules, each lasting 30 minutes. So there are tasks to complete at home following the completion of each module. Then this is following up with a telephone with a therapist. There is a license needed to access Aussie, which does have a cost implication attached to it. But those are the 2 different formats of intervention for parent-led CBT. So just looking very briefly at the evidence base around this. So the team at the University of Oxford are running research studies looking at the effectiveness of the online intervention, so of Aussie. The COCAT study found that there were reduced rates of anxiety following the intervention. It was found to be more cost effective compared to other brief psychological interventions. And it's found to be just as effective when delivered by people who were new to CBT with support as it was when delivered by experienced CBT therapists. So the research is, there is a published paper from the COCAT study, but there is also an ongoing study which is called Aussie Grows, and this is looking to continue to evaluate the outcomes and usage of Aussie currently in routine clinical practices, and this work's ongoing. So if you have any more, want any more information about it, there is on the University of Oxford's page, and if you look for the parent-led CBT, there'll be information about those studies and anything particularly with that intervention on there. So we have been working for the last couple of years now on the Working on Worries project. So it's an implementation project, as Bonnie said, not a research project, which was funded by the National Institute for Health and Care Research and the MHIN, and conducted in collaboration with the Norfolk and Waveney Integrated Care Boards, the ICB, with our trust, and very other sort of local partners, and the East of England Applied Research Collaboration. So just sort of looking a bit at the background information. So we know that research shows that around 50% of anxiety disorders begin before the age of 12, which means that primary school years is an important window for early intervention. About 6.5% of children are affected by anxiety disorders. So these issues can seriously impact their learning, friendships, and the sort of long-term mental health if it's left untreated. So despite the need, many children don't get access to the evidence-based treatments like CBT, as obviously services are continually being stretched all the time. And schools are often the first place where anxiety does show up, but staff often lack the training or resources to respond effectively to these issues. So this project is part of MHIN identifying parent-led CBT as a useful intervention. We saw an opportunity to bring parent-led CBT particularly into schools to help close this gap and to see if it was possible. So the main aims of the project was essentially to reach as many primary schools as possible and support pastoral workers within these schools to deliver parent-led CBT. So we wanted to optimise delivery through the use of children and young people's mental health professionals, with them working directly with pastoral workers and supporting them across the system. We would look at evaluating what the barriers and facilitators were to successful implementation to help make this as sustainable as possible. And the focus of the project was not on clinical outcomes. We did capture this, but this wasn't the main focus of the project. But we were particularly just more interested about how the implementation outcomes would inform future work in this area. So before this project, there was a pilot study involving the Nebula Federation of Schools in Norfolk. They were looking for a way to move away from crisis management with their pupils and move towards an intervention support for them. So while schools are able to support in many ways, they are quite limited in what they can provide. So being able to provide an intervention such as PLCBT has been able to fit in with their sort of holistic goals. And the pilot did show three things from that piece of work: that there was a reduction of parents, carers reporting of the reports of the impact of anxiety on their children's lives. They perceived the programme as easy to follow and flexible, and school staff felt the programme was acceptable and they felt confident in delivering it. And as we were expanding on the pilot, we wanted to make sure that this was following an effective implementation model, and I'll discuss the EPIS framework on the next slide. We had a core project team, which I'll name at the end, and we were guided by a stakeholder steering group and a parent advisory committee, which I'll also explain later in the slides. So the basic model of the study was to identify and upskill local trainers, then to invite the primary school staff to attend training in helping your child and Aussie, then provide ongoing support in the form of group sessions facilitated by trainers, and then we'll monitor the implementation outcomes to make improvements and implementation on the implementation strategy. So looking at EPIS briefly, so to expand the approach further to more schools across Norfolk and Waverley, we want to optimise this implementation process to ensure to looking at the literature around implementation science, which could help us to put this implementation into practice. So it was decided to use the EPIS framework. So this stands for exploration, preparation, implementation, and sustainment. So the initial phase, exploration, a lot of this work was already carried out by the MHIN team, and it was felt that sort of parent-led CBT fits in the needs of children and young people with ongoing anxiety difficulties, and obviously identified primary schools and pastoral workers as being an effective way of implementing this. So we used this framework to help us think systematically about each stage and how we could prepare pastoral workers in primary schools, introduce primary implementation strategies and scalability from the very beginning. And then obviously it's also looking at what are the factors and the context within this that support these this EPIS framework. So looking at the preparation, so for this phase of the strategy, we knew that having a core project team would be the key to implementation. So we made sure that there were leads from Norfolk and Suffolk NHS Foundation Trust, from the ICBs, from Cambridgeshire Community Services, having parent and carer group leads involved as well. And what was particularly useful was having a school representative as well. So having a voice from one of the schools sort of ongoing throughout our work was so important, and just made sure that anything that we did action was applicable for schools and that it would be correct. So we wanted the project to be owned by the system. So for the first year of the project, we set up a stakeholder steering group, which also had representatives of parents and carers, members of the Integrated Care Board, provider organisations and local authorities. So they all had a shared accountability and ownership of this project. With sustainability in mind, we implemented the trainer-trainer model. So we had local child and young people's mental health practitioners trained up in training of parent-led CBT. They included educational mental health practitioners, children's wellbeing practitioners, educational psychologists, and one of our pastoral workers who worked on the pilot study as well. So we wanted to focus school recruitment for those that weren't accessing mental health support teams at that point. And we also looked at the wider contributors of poor mental health and started to stratify our approach to identifying schools that would be offered this opportunity first. And as part of the funding received for the WOW study, just to mention that we did purchase licenses of the Aussie intervention, and so these were obviously provided for free for schools that did sign up for the study. And we also thought about the experience for pastoral workers to be trained, so we provided nice training venues, had a nice lunch and ordered books for them. Printed resources just to make things basically as easy as possible for them to take back the information to their schools afterwards. And these may seem like small things initially, but it did help give the school staff attending an opportunity to network and to really engage with the training, as they were sort of completely away from the school environment. And these sort of opportunities are far and few between, so they all appreciated that opportunity to sort of be involved with the study. And most importantly, we identified an implementation lead in each school and developed an implementation planning tool based on the EPIS framework, so that this lead could help us identify and overcome any implementation barriers, because obviously this would sort of be different, and trying to do a one thing fits all for every school would be quite difficult. So we tried to get each school thinking individually about what could be their barriers to help them and identify parents from the very beginning. So then moving on to the sort of implementation part. So we provided resources, so guidance, and leaflets and other sort of useful documentation. We provided the outcome measures data tool, so for their ROM support. So there's a pod, which was an online outcomes data tool. So we provide that available for them if the pastoral staff are using the Helping Your Child method rather than the Aussie intervention. To maximise adherence of the intervention, we offered a collaborative learning and support sessions, and these were known as class sessions, and I'll talk about them a bit more in the next slide. And then to support the long-term sustainability, we initially used an external trainer, but that was so we could focus on developing local trainers, so the programme could hopefully become self-sustaining for the future. And we made sure this was a programme of work that fitted in with our local commissioners as well. So just to talk about the class sessions. So these were sessions facilitated by our trainers, and it gives pastoral workers an opportunity to talk about cases and share thoughts with other schools. Once again, we hope this shared learning space would support building relationships between the health and education sectors. So we've been altering the strategy of how we implemented certain things throughout the 2 years, so to suit the needs of the schools. So, for example, after the first year, we found that attendance to the class sessions were pretty low. Obviously, once they're in school, they're going to have a lot of different competing time pressures, as they were originally fortnightly. But we found that moving them to a once a half term fit more in line with the school timelines. And since we did that, and it was sort of less regular, we found that there was more of an increase in attendance. And then to support that as well, we did also ask schools, they were required to sign a class agreement, so that if they don't repeatedly, or if they do repeatedly not attend the sessions, then there was a possible we would revoke the access to Aussie, because part of having Aussie is to make sure that there are sort of supervision or training sessions provided alongside that as well. So it's one way just to make sure that they were attending those sessions as well. So that sort of covers the, excuse me. So that covers the EPIS framework and how we went about it. So the next few slides just look at sort of the outcome over the last few years about once we'd sort of implemented it and got it running. So over the process, we have trained 33 trainers and facilitators for class sessions, 220 pastoral and school staff across 130 different primary schools in Norfolk and Waveney have been trained. And so far, around 230 families have accessed parent-led CBT. So 177 have accessed the online intervention and 55 with Helping Your Child. We received the Helping Your Child data from demographic sheets, which we were asking for throughout the study. So not everyone were completing these. So we expected it was sort of an unreported amount, and that there would be more measurably Helping Your Child cases that were using the intervention that were reported to us. So we had a few insights from the trainers. So at the end of the first year, we conducted focus groups with the trainers. So they felt that the work fitted in with their usual roles. This role of promoting early intervention fit in within their services. Sometimes time dedicated to the project wasn't recognised by the service leads, as this work was seen sort of in addition to their current roles. And then looking at the experiences of training school staff, it's felt having different perspectives, such as from education sectors and mental health services. This had a real benefit to the school staff and the trainers as well. They could sort of have real life and healthy discussions around in those training sessions. There's benefit of having trainers that have experience in delivering intervention, so they can demonstrate how intervention could be applied in different presentations and different cases and scenarios. So we originally had 4 trainers delivering parts of the training sessions. This helped put them at ease. So as the spotlight wasn't always on them, so rather than just having one person deliver everything at once, everything was sort of done in pairs just to break up the sessions a little bit over the couple of days training. This helped keep the dynamics of the training and kept it quite conversational. So although I mentioned that the project wasn't specifically looking at clinical outcomes, we did get some initial data from the first 62 families that had completed Aussie. So the revised children's anxiety and depression scale and the child anxiety impact scale. So I'm definitely not a stats person, but the pink is the effect size, and on the left-hand side with those 2 measures, minor scores are good and is what we're looking for. And the right side with the goals-based progress and the outcome measure, want to see there to be a positive number there, which there was. And so the difference between module 1 and module 6, although there's quite a bit of difference there, is just to show that even after completing one module, it showed that the children were already making progress towards meeting their goals even after the first session. And so far, it's obviously nothing's written in stone, but so from the University of Oxford team, they've looked at this compared to their other studies which are running, and so far these results are comparable with other looking at the outcomes of parent-led CBT from other trials. So we're sort of getting good results from those from that aspect as well. Briefly, we're looking at the preferred format of the interventions. So this is looking at the feedback from the school staff and from their focus groups. So each influencing factor was rated when deciding which format to offer. So Aussie was a preferred format delivery for most schools, as this was used over 3 times more than the HYC format. Family preference and staff capacity were the main factors that led to this. Aussie was felt to be more time efficient and flexible for parents and carers. They could complete these in their own time rather than coming into a set meeting point with staff, as they would need to be for the face-to-face sessions. So looking at the facilitators and barriers, so these were identified by school staff. So school staff felt that they had prior existing relationships with parents, carers, and children. So they're well placed to identify who the intervention would be appropriate for. The main barriers were staff capacity and time capacity. So this made it difficult to deliver it to as many people as they had hoped to deliver it to. However, the benefit of having the online intervention did have some effect into limiting some of those barriers. And as in previously, Aussie was overwhelmingly chosen as the preferred intervention, as this was more time efficient, convenient, and flexible. And then just a few more school reflections. So the staff found it has supported building positive relationships with parents and has helped empower the parents as well. They found that they've reduced onward referrals to specialist mental health teams. School leaderships found that having this time-limited approach can help schools plan how to support children, and this support can be provided straight away from when they notice any anxiety difficulties. Excuse me. As part of the focus groups and surveys we ran, we've got some really nice quotes here, which show the benefit of the work we've been doing over the last couple of years. I won't read them all out, but I'll just read out a couple of them. So from a school staff member, I went from a chart of sea of red and yellow to just green and yellow at the end. And it was just lovely to see. It was quite powerful to show. The parents were quite emotional about seeing that. And then another one from a parent carer. It's been really good. We have definitely seen a change in our daughter. We understand how to deal with her anxieties and how to support her in the future. Family life is less stressful. So it's quite a wordy slide, but just to sort of explain some of the phases of the project. So and where we are at the project life cycle. So the first phase, first year, January 23 to March 24. So this was funded by MHIN. And as mentioned, we focused on schools which didn't have a mental health support team attached to them. And in the second phase, from January 24 to March 25, this was funded by the Norfolk and Waveney Integrated Care Board. So we expanded access to this intervention across to all schools that were interested. So it's sort of like an open invitation at this point to every school to contact us. We did lots of sort of like advertising of it in sort of like open school newsletters. So most schools had the chance to have the opportunity to run parent-led CBT if they wanted. We also provided access to Aussie for Ormiston families and MHST staff as well at CCS. And during this time, in March 24 to March 25, we've also been working on an implementation guide toolkit, which we'll be discussing sort of just later in this discussion. And since April 2025, following sort of the successful implementation of the intervention, the Norfolk and Waveney ICB have continued to fund the intervention for another year. And now, with this sort of being more closely aligned with MHST staff, it's felt that it being hosted in at CCS was the most appropriate sort of avenue to keep this project moving forward. So that's where we're sort of at. So we've got a WOW overview there. So I'd briefly mention the public and patient PPI involvement and their input into the study. Originally mentioned, we had sort of our stakeholder steering group, which had representatives, mental health services, commissioners, education staff and parents and carers, but we also had the parent and care advisory group. The key part of their involvement where this group where the parents and carers of that had experience of children who had experienced anxiety, and those insights were invaluable. So this group was facilitated by a peer researcher. It helped bring alive sort of the experience, the lived experience, into sort of part of the study, really. So they helped us understand what really matters to families, what would work and what wouldn't. And their feedbacks helped shape how we've sort of communicated with families throughout the whole process, really. Um, so not only were they providing feedback about the study, but they were also co-producing outputs of the project, which some are listed here. So there were video testimonials that they provided, and hopefully it's to sort of share real world experiences and to help produce keep more of it. Produced frequently asked questions and responses to common concerns, so based on what they knew other families would want to ask, and information sheets that parents could share with their extended families. So I know that in this group, for example, one of the parents was talking about the difficulty of trying to do the intervention at home and then their child going to stay with their grandparents. So they started to talk about blended families and separate households and how to get the main message across about CBT without having to explain the whole entire intervention to their grandparents. So from those conversations, they developed sort of co-produced a poster of the main key points about the intervention in an easy to read format that parents and carers would like to sort of share with their wider family. So if there's a sleepover or anything at a grandparent's house, they can provide a poster and look at what things that they can do to help support the child whilst they're in their care. And I know that some of these materials were also worked with the University of Oxford team and provided on their studies as well. So they've had a real sort of input into how the study was shaped. So I'm just going to talk about the animation that was most recently created. So following one of the PCAG meetings, the group felt it'd be good to provide children with a visual format to answer any important questions they might have before taking part. So the questions and script were written by one of the children of the PCAG group, and they sort of had undertaken parent-led CBT earlier in the project. The lead of the PCAG had started to write a script. They thought it'd feel more authentic being written by one of the children themselves. So quite a lot of time, obviously, processes it takes to be involved to try and set up that process. But they created this animation, sort of a frequently asked questions, which can be provided to children, and hopefully you'll be able to I'll play this and you'll be able to hear the sound as well. Apologies for any lagging, but the sound should sort of come out okay.
We asked some children what they would like to know about a parent-led CBT program for children with fears and worries. The children who had done the program answered their questions from their real-life experiences. This video is for children and their families who want to know a bit about what the program can be like. Zachariah and their friend Honey are having a conversation about starting their parent-led CBT program.
Hey, Honey.
Yeah, what?
My mum said that I'm going to take part in this thing that will help me get over my fear of the dark.
Oh yeah, I've done that. It helped me go on a plane for the first time.
I'm scared to start, and I have some questions that I don't want to ask my mum. Can I ask you them?
Of course. I would love to answer your questions.
I'm shy. I don't really like sharing my feelings with everyone. Will my friends find out, and do I need to talk to strangers?
Of course you don't. I told my friends because I trust them, but I didn't tell anybody else. I think everyone's experience is different, but I didn't have to talk to strangers. There are different things for different people.
Thank you. Could I ask you some more questions?
Yeah, go ahead.
Thank you. Will it be fun, and is it going to be hard?
I love doing this. It was so fun and I like the rewards. It gets harder along the way, but when it happens you feel ready. Me and my dad worked on the steps together and I got to choose my rewards.
Thank you for helping me. I feel better. I've got 2 more questions.
Yeah, go ahead. I love answering your questions.
Will this actually help me, and am I going to see results?
This was so helpful for me, and also really helped my self-confidence. Even though it's over, I still learn from this and think back to it all the time.
Thanks for answering my questions, honey. I don't feel as worried to start it now.
No problem. If you have any more questions, you can ask your mum, and if she doesn't know the answer, she can find out for you.
Okay, so that was the animation. So I know that the group were really happy sort of how that was presented, and this can be available to all schools and parents, carers, children before being able to provide as a resource before they decide to take part in the study. There we go. So just I know sort of getting close to time, so just to briefly mention the implementation toolkit. So whilst we've been sort of recruiting more schools and pastoral staff over the year, we've also been looking at how to provide a toolkit of how we implemented this intervention as a guide for other services or areas to consider. So MPIM wanted to make sure that the project was sort of sustainable. So they funded the production of this implementation toolkit. And we know that our team have had discussions with commissioners from other areas who are interested in implementing this, and also met with the team at the National Institute for of Mental Health in Czechia, who are looking at providing parent-led CBT in non-clinical organisations. So we know there's a lot of interest around about the study. So initially we held a workshop to see what resources we had and what the core content of the materials might look at. We then took this out to a stakeholder consultation, where we went to mental health support teams, parents, carers, school teams, where the following sort of themes were identified. So the main focus was on what support is required, how to identify and engage families, what are the barriers and facilitators, and how can the intervention be sustained. So the toolkit is created providing comprehensive information about how we implemented the intervention in a school setting. It's currently being tested on stakeholders with no experience of the intervention. This is using semi-structured interviews to collect feedback. And then we're sort of at this stage where we're just undergoing final revisions before being available for wider use. And as part of that, we'll review any of the sort of the parent carer facing documents that we've completed throughout the study. And then all of this information will be held on an NSFT webpage. Can't provide the link at the moment because it's not live. But once that document is ready, we'll have the toolkit on there, all the co-produced resources and the animations and the testimonials as such, and any other sort of resources that will be useful to use. But if anyone is interested in knowing what the web page is, once it does go live, they can just send me an email message, and I'll keep a note on the distribution list once this does go live. So although I'm talking about the study with you all today, I did mention a lot of we's and throughout the slides, and I am only a small part of the study, so I joined it slightly later than when it started. So the hard work's already been done by these wonderful people. So we've got Tim Naylor at the ICB, University of Oxford staff, Kathy Cresswell, Chloe, the PCAG leads, Rachel and Alexia. Ashley Brown was our school lead, who helped us, who was sort of an integral part of actually getting this sort of off the ground from the pilot stage and throughout this whole process. She's been amazing. And then following other sort of teams and services we've been in support with at CCS and Ormiston, and Catherine at the University of Central Lancashire has been helping us with the implementation guide. And then obviously staff from the research department within NSFT, Bonnie, John, Bryony, Ella, Luke and Theo. So thank you everyone. We've only got 5 minutes by the looks of it, but I'll just stop sharing my slides.
Thank you. So thank you very much, Tom. Really interesting and lovely to see it all come together after all these years
Yes.
of hard work. So I haven't got any questions in the Q&A, but if anybody wants to actually ask a direct question, if you want to put your hands up and I can unmute you, if you so wish, if that would feel better. Otherwise, I'll just give a plug for where you can find this recording at the end, but I'll just give you a couple of minutes to have a think. A couple of seconds, really. No, I think we're all good on the question front. You got away with it there, Tom. Well done. Oh, yes. Yeah, all good. It was so clear, you see.
Exactly.
There we go. So just to kind of give a bit of a plug, we are going to be taking a bit of a break for the webinar series over the summer. But we will be back probably in September. We might have one in August, but September's the next booked person. If you're interested in looking back at some previous seminars, and let me just hide the presenter view, previous webinars, seminars, or other materials that we have, we do have a YouTube channel, which is where this webinar will be placed. And we have our webinar from last month with Professor Rebecca Gould, who came to talk to us about the contact GAD study as well. And we'll be building up a library of these webinars over the course of the year and into next year that you can access whenever you like. We will also put the link to the implementation toolkits and the resources that Tom talked about on our YouTube profile for this webinar as well. So that'd be a different way that you can get the information if you so wish. So that is everything, unless we've got any last minute questions. It is not. So thank you very much to everyone for joining us. I hope you have a very good weekend. Enjoy the sun, and we'll see you all later. Thank you very much.
Thank you, everyone.
Thanks.